Hi, I'm Don Berwick, a pediatrician and President Emeritus and Senior Fellow at the Institute for Healthcare Improvement, IHI, here in Boston, Massachusetts. I very much wish I could be joining you in Wales for this amazing conference, celebrating 10 years of work of the Bevan Commission and 70 years of history of the National Health Service, one of the great examples of a social commitment to equity, justice, and well-being in a population. It's a privilege to join you this way, and I thank you for the opportunity. You're celebrating your past and thinking about your future, and you're doing it from an international perspective on health and healthcare systems. You know that Wales and the NHS as a whole is in good company. Nations all over the world are struggling with how to make healthcare finally move forward for the achievements for health and well-being in populations that actually are within reach but not yet within grasp. Healthcare systems all over the world, like you, are trying to understand how to rebalance our endeavors. We have proudly invested for decades in building a healthcare system that treats people when they get ill and can now rescue lives through the adoption and use of technologies and the approaches to care that are represented in the great institutions of healthcare in Wales, in the UK, and around the world. But we know the balance is off. The causes of illness do not lie inside healthcare, they lie outside healthcare. And if we're really interested in improving the lives of patients and families and communities by prevention, by interception of deterioration of health, we're going to have to broaden our vision. We're going to have to work way outside our traditional healthcare systems on the real generators of ill health. We can do that, but we haven't done it yet. And what's going on in Wales right now through the leadership of the Bevan Commission and others of you is serious contemplation about how to move healthcare systems toward health and well-being while assuring the very best care for people when they fall ill. It means a commitment to effectiveness. Healthcare systems have not yet found a way to make it possible that every single person gets all the care that can help them and only the care that can help them. And that commitment to using science every single day and every single endeavor in healthcare is a route to better outcomes, better health for populations, and by the way, lower costs so we can reduce waste in our healthcare systems. Importantly, among the social determinants of health, there are none more important than equity and justice in healthcare. You benefited this conference from the advice of Sir Michael Marmot, one of the great leaders in the world, helping us understand how closely related a commitment to equity, solidarity, and mutuality is in supporting the pursuit of health and well-being. If there needs to be a theme for the next wave of evolution of the National Health Service throughout the UK and in Wales, then we're going to have to talk about how to bring equity to the forefront in pursuit of health and well-being for our communities. And there's a revolution in the global landscape on methodology. For too many years, for too many decades, healthcare systems, public and private, have committed to inspection and contingency and metrics as somehow a magical way to achieve improvements in healthcare. Many healthcare systems have found themselves trapped in forms of surveillance and reward and punishment that do little to improve care, really, and that have the effect of demoralizing a workforce that's going to work every day to try to do well for the patients they serve. There's a better way, and Wales knows it. The better way is learning, to come together as a community with clear goals for the improvement of health and well-being, to achieve the triple aim of better care, better health, and lower cost, requires a culture in which we help each other learn every day to change and evolve the systems upon which our patients and families and communities depend. That transition from an inspection-oriented culture that cannot achieve the future we want to a learning-oriented culture that is the only route to achieving the future we want is well underway throughout the world in many nations that are thinking hard and well underway in Wales. For the National Health Service, there's a special burden, a special duty, because the National Health Service has the chance to offer, more than perhaps any other form of healthcare system, real routes to better care, better health, and lower cost by acting as a system. The National Health Service, in its conception, back to Aneurin Bevan and its chartering foundations, are a recognition by a country that you're in this together, that you're committed to each other, and that you have a theory of solidarity around the pursuit of health and well-being for your populations. The whole world watches the National Health Service in the UK and in Wales especially, because we're looking for examples of that truly integrated view of how to deal with the health and well-being of populations. It's a special opportunity and a special burden, which must not be squandered. The National Health Service, in its 70-year history, has set an example for the world of commitment to health and well-being as an absolute guarantee in a society. And in its next 70 years, it has to make that real as soon as possible. And within that context, Wales has something very special to offer. The National Health Service in Wales works with a platform of possibility that actually most countries don't have. You're the right size. The Welsh community is a community, and I've had the great privilege of being in Wales when many stakeholders have been able to come into the room and think as other nations can't about the nation as a whole. You know each other, you have affection for each other, you're a unified nation as much as you want to be. You have the right culture. The commitment to communities and social justice in Wales is something you can feel from the moment you arrive in that country. And I see a special opportunity in Wales to build further on that sense of of Wales as a community of joint endeavor. You have the right history. Wales, for a decade now, has invested in the proper approaches to improvement through learning and collaboration. The 1,000 Lives campaign in Wales was really an international example of how a country can come together with a clear goal and work together to get that goal done all together. You've built, through the Bevan Fellows and through other investments in your workforce, a very strong cadre of people within Wales who understand improvement and who know how to work together to get the job done. And you have the right plan. I personally believe that prudent healthcare as a model, as a conceptual model for the foundational charter for the shape and commitments of a healthcare system, is a world-leading model. I think prudent healthcare has in it the potential for designs of care that, if realized, would achieve better care, better health, and lower cost for Welsh healthcare. Now, you are at the threshold of generalizing what you've learned through the prudent healthcare model to a prudent social model. And that combination of better care through the principles of prudent healthcare and better social care through the new principles that will emerge for a prudent social model, I think it offers a potential for at last having a nation achieve the integrated approach to health and well-being that all nations are actually aspiring to. I had the enormous privilege of serving on the Parliamentary Commission in Wales that was commissioned to think about the future of healthcare in Wales, and I saw in the work of that commission and the testimony we had from dozens and dozens of witnesses, I saw the commitment that we're after, that commitment to make Welsh health and well-being and healthcare truly responsive to the needs of communities at a level that most other nations haven't been able to achieve. And I have had the great privilege of working now for a decade with the Bevan Commission. I want to tip my hat to Sir Mansell Aylward, a close friend and leader whose words of commitment throughout the work of the Bevan Commission have been inspiring to me. The Bevan Commission itself, through its work on prudent healthcare and its consideration about strategies for change in the nation, I think is a great gift to your country. And building on that will help you achieve the promise of the NHS of the future. The challenges of the future are enormous. We are talking still about change, drawing upon the parliamentary review, drawing on the prudent healthcare model, and keeping focused on not just the triple aim, but the quadruple aim: better care for individuals, better health for populations, better value for the pound, and joy in work. That will be a continuing journey. There are changes that are going to have to be embraced still in the Welsh healthcare system. The crucial one is the one you're talking about at this meeting: integrating health and social care. An idea with immense intellectual force behind it, but as yet unrealized really in any nation. You have a potential to finally make health and social care sing together as they need to. You need to find ways to sustain improvement as a strategy, Especially in a government-funded system, there are always distractions in the media, distractions in political change, distractions in the crisis of the day. That's not the way to have the Welsh health and well-being you want. Continuity of purpose, sustaining improvement as a strategy over years, even over decades, over changes in government, over media frenzies, but understanding that you have an aim, prudent healthcare, prudent social care, and you can get that done, but only with constancy. You have the challenge of joy in work. It will be impossible to achieve the forms of care, the well-being of the society that you want without the healthcare workforce being proud and joyous in what they do. And under the stresses of modern healthcare, technology, the exigencies of budgetary pressures, it's very, very hard to maintain a focus on that essential resource, joyful work. And I urge you as a nation to assure the health and well-being of the healthcare workforce itself so they can help you get done what you need to get done. You're going to need to embrace the new care. There are forms of new approaches to care that are very exciting and very challenging to old models. The adoption full scale of digital healthcare, telemedicine, telehealth, the ability to project care electronically, to replace visits with reaching out and relationship building. You have a new healthcare workforce to develop. Doctors, nurses, pharmacists, therapists, they're all necessary, but we have whole new possibilities for community-based resources, community health workers, and others to become full participants in the pursuit of the health and well-being you want in your nation. This will take patience. It won't happen overnight. It will take constancy, but Wales has it. You've done it. And most of all, it will take learning. You cannot do this separately. The only achievement possible for the health and well-being of the Welsh population is accessible through learning and shared development. It's what you do together that matters so much more than what you do separately. Your silos are over. It's time to be together as a unified nation seeking the health and well-being for the population that you can and should have. Thank you very much for the chance to join you this way. I wish you a wonderful conference, and I look forward to many future trips to Wales to celebrate the progress of the past and the progress that will now appear in the future. Thank you.